Namaskara, good morning. I'm going to talk to you in brief about cervical cancer. This is Cervical Cancer Awareness Month. You can see that the uterus has two parts, the body and the cervix. The cervix is the lower part of the uterus, which can be seen from below by the clinician. Actually, the cervix itself has two parts. One is called the exocervix, the outer part which can be seen by the clinician, and the inner part called the endocervix, which is generally not visible by the clinician on examination. Cervical cancer and precancer is caused by the human papilloma virus, and there are more than 100 types of human papilloma virus which are known. It is predominantly transmitted through sexual route. It's a double-stranded DNA virus. There are two important strategies in reducing the burden of cervical cancer in India. One is vaccination, the other is screening. There are three commercially available vaccines: Gardasil, Gardasil 9 and Cervarix. Gardasil 9 protects against 9 serotypes of cervical cancer, Gardasil against 4 and Cervarix against 2. The vaccine is given in children between 9 and 14 years of age, and catch-up vaccination is accepted up to 26 years of age. Gardasil is licensed for both boys and girls, whereas Cervarix is licensed for girls alone. They reduce the risk of cervical cancer as well as other cancers caused by human papillomavirus. The next important strategy about cervical cancer is early detection. The medical parlance used for this early detection is called screening. So cervical cancer proceeds in an orderly way from infection to pre-cancer to cancer. What we want to detect in women is infection and pre-cancer. The good news is that majority of infections are self-limiting and they resolve on their own. A small percentage of patients will develop pre-cancer, and pre-cancer will develop into cancer. The WHO recommends screening for cervical cancer from the age of 30 years up to the age of 65 years. This is done by a simple test called HPV DNA testing. In places where the resources are not available for HPV DNA testing, a pap test can also be used. If it is a HPV DNA test, the test is done once in 5 years, and if it's a pap test, the test is done once in 3 years. Cervical cancer is the second most common cancer among women in India. So a significant number of people do develop pre-cancer and cancer. In the stage of pre-cancer, it is relatively easier to treat the lesion using a procedure called loop electrosurgical excision of the transformation zone. In cancer of the cervix, it's called invasive cancer. Early stages will require surgery in the form of a radical hysterectomy. You should understand that radical hysterectomy is different from the simple hysterectomy which is used to treat benign conditions such as fibroid uterus. And radical hysterectomy is usually generally done by an oncologist. In patients who have more advanced stages of cervical cancer, multimodality treatment in the form of chemotherapy, radiotherapy, and in certain instances surgery will be required. I really hope that this information was useful to you, and this information is given to you on the occasion of Cervical Cancer Awareness Month, that is January of every year. Have a good day.